Hey guys, this is video number 2 in my VBAC series, and today we're going to talk about VBAC tolerant providers versus VBAC supportive providers. Okay, so before we get started, I want you to go down into the comments and type, "I'm gonna rock my VBAC." When we're doing these VBAC series, I want you to type, "I'm gonna rock my VBAC" in every video, because I want you to keep that positive, excited attitude. We're gonna rock this VBAC, okay?
As always, this video is meant to be for educational and informational purposes only. This is not meant to substitute for medical advice. If you have any questions, please refer to your provider.
So I want you to go ahead and get a notepad, because I'm going to give you a list of 7 questions to ask your doctor or midwife when you are looking for a provider for your pregnancy and trying to achieve a VBAC. So the first question you're going to want to ask is, what is your VBAC success rate? I can't give you a specific number that you should be looking for, because it's going to really depend on a variety of factors, like how high risk the population is that your provider sees, how often they do VBACs, but in general, we want to see probably around an 80 to 90% success rate. In general, VBACs should have around an 80 to 90% success rate, so if your provider's VBAC success rate is in that area, that's really good. If they're around 60 to 70%, I'd be a little cautious. So question number 2 is, you're gonna ask them, what are your feelings about me going past 40 weeks or going past my due date? This is really important, because a VBAC tolerant provider will say, yeah, we support VBAC as long as you go into labor naturally before your due date. If you don't go into labor naturally by your due date, we'll schedule your C-section for 40 weeks, or we'll schedule your C-section for 41 weeks. That's not VBAC supportive. That's VBAC tolerant. VBAC supportive provider has familiarized themselves with ACOG's protocols and will be supportive of you going past your due date, because that's normal. And they aren't going to push you into induction, because they know that that can actually increase your risks. And they know that if you do choose an induction, that actually is a slightly lower risk than a repeat cesarean. Which brings me to question number 3. How do you feel about induction with Pitocin for your VBAC patients? We've talked about induction a little bit before. We've talked about why we want to avoid inductions, but the truth is sometimes they're necessary. And ACOG supports a slow dose of Pitocin for induction for VBAC clients. They would rather you have an induction for medical reasons than an automatic repeat cesarean, because you're afraid of a slight increase in rupture. Yes, Pitocin does increase your risk of uterine rupture, but it takes it from about 0.3 to 0.8% up to about 1.5%. So you still have a 98% chance of having a successful vaginal birth without a uterine rupture if you have Pitocin. So that's something for you to decide based off your own risk factors and your own wishes, but a VBAC tolerant provider will hear of no such thing. A VBAC supportive provider knows that ACOG supports using Pitocin for induction for VBAC patients if medically indicated. Question number 4. How do you feel about me laboring at home as long as possible? This is a question you should really be asking your doctor and your midwife, no matter what, whether you're a VBAC or not. But if you are trying to reduce interventions and minimize the amount of interventions you're having, then you need to minimize the amount of time you're in the hospital. That's just like labor doula support 101. If you're minimizing interventions, minimize the time in the hospital. This isn't to say you need to stay at home until you're pushing, but it is saying you don't want to get to the hospital in super early labor just because they want you on a monitor right away, because then you're going to increase your risk of a whole bunch of interventions, and that could in turn increase the risk of needing a repeat cesarean. Question number 5, how do you feel about me hiring a doula? So unfortunately, even though doulas are becoming a lot more popular, a lot more well known and respected, some providers unfortunately just refuse to work with doulas. They don't feel comfortable about having doulas in the birth space. And I think that's really sad. And that's a conversation for another time. But I want you to ask how they feel about you having a doula. If you're considering having a doula to help you decrease those interventions and use alternative comfort measures, then you need to make sure that your support team is going to work really well with that. Your doula is part of your support team and your provider is part of your support team. We play different roles. The doula is never trying to take over the doctor's role, and most doctors know that the doula knows her role and will be supportive by the mother's bedside when necessary. Like, most doctors should know that the roles don't overlap. So if your doctor is not okay with you having a doula, then they're probably not supportive of physiological birth. Question number 6 is, does the hospital offer wireless monitoring? Wireless monitoring gives you the opportunity to be up, mobile, moving around, maybe laboring in the shower or in the tub. And these are all things that are going to help reduce those interventions and help increase the odds of you having the birth you're dreaming of. And question number 7 is one that's kind of hard to ask if you really just don't want another cesarean and you don't want to think about C-sections, but it's a really important one to ask, and that is, under what situations and what scenarios would you request or require or encourage a repeat cesarean? Now, there might be legitimate reasons for this, there might be illegitimate reasons. For example, if they say, oh, we'll schedule your cesarean for 40 weeks if you don't go into labor first, then they are VBAC tolerant, not VBAC supportive. Now, if there's a different medical condition, like, well, you know, if you have placenta previa, of course you're going to need a C-section. If you have XYZ situation happen in labor, it could mean that we need to do a C-section. If they're willing to talk that out with you and answer your questions and you're comfortable with their answers, they might be more of a supportive provider than just a tolerant one. I hope those 7 questions are going to be helpful for you to find a provider that meets your needs and is truly supportive of reaching your goals. I want you to ask your number 1 question about VBAC in the comments so that I can answer it in one of my next VBAC series videos. So if this video was helpful to you, go ahead and hit like for me. That way other families can find the video and get the same great advice. If you thought it was great advice, if you thought it was crap advice, go ahead and hit that dislike. Please don't do that. And if you really enjoyed the video and you want more updates from my VBAC series, or you want other labor and birth tips and tricks, breastfeeding tips, go ahead and hit subscribe and make sure you hit the little bell so that you always get notified when my new videos come up. Thanks so much for hanging out with me today, guys, and I look forward to sharing more tips and tricks with you in the future. Bye.